Hi, my name is Juliana. I got to know that you wanted to see me. Is there anything I could do for you?
Yes, I called your PA yesterday. I feel like talking to somebody.
Well, you came to the right place. Please make yourself comfortable.
Thank you.
So, tell me, how may I help you?
I've been having some symptoms of been bothering lately.
Can you tell me about that well?
I just moved into an apartment. It's the first time that I'm on my own, and I kind of had hear someone got robbed and ever. Since then, I'm kind of nervous about my apartment getting robbed someone.
Someone was robbed near where you live?
Yeah, someone in the same complex. So sometimes when I sleeping, I will wake up in the middle of the night and I'll think that I locked the door. Is the door locked? And I will get back to sleep.
So, how long does it take you to feel back to sleep?
Sometimes it takes me an hour too.
And what are you thinking about during that time?
I'm just worried that I left the door unlocked and sometimes sounds nothing. Maybe someone's in the apartment or I just get nervous. I just get scared for the door no mom.
So that sounds crazy. And you said a couple hours. You stay away. It's a lot. This is
Yeah.
troubling for you. Have you ever got nothing check the door?
No. I think bit and I just try to I but I just think about it.
I see. You just keep thinking about it. Does it get worse as the time goes on, or does it get better? What's happened?
It get worse. I mean, I try to fall back asleep. I stay bed in the bed and I just think, maybe I did leave a door locked and I just keep thinking that maybe it isn't locked.
So it's kind of keep cycling through the same. Do
Yeah.
Do you ever do anything to try get those thoughts to go away, like focusing on something else?
Well, I have like a ceiling fan above me. Sometimes I just like count on how many times it goes round and just try to distract myself from thinking about it. But I still think about the door being unlocked. Sometimes it helps.
All right. So you have a fear that somebody is going to enter, break to wherever you live, and you are staying up at night thinking about whether the dots been secured that been showing you. So anything else?
Sometimes, if I am leaving for work, I will go get to my car and I'll think I got the hair straightener woman and I think to myself, should I go back? And I don't know what to do and I just like kind of debate whether or not I should just go double check. I'm just worried that if I let the straightener on, something, like that would happen.
You think what might happen?
Well, I mean, if I left the straightener on something, it's if I like clothes or something, it's on a cloth like that could burn if I just don't want anything. I don't want the place to run down there.
So when you are leave, you are thinking about it was a hair straightener.
Yeah.
You are thinking about the whether you unplug it or not, turn it off or not, and how long those
Yeah.
thoughts go on for you.
Well, normally I think about it before I go to my car now, but maybe I should just go just to make sure I unplug it and I turn it off. And then sometimes during the day, I will be at work and I just can't focus because I'm thinking about it. I will come back and I'll see you. No, my apartment burned down, so that's the straightener plugging.
Alright, so I remember with the door, you are saying that you stuck with those thoughts, but you do not get up and check the door. Have you ever come back and checked to see if some of those left a little?
No, I've eat, but I think about it like, what if I did leave it if I don't leave it on earth? It
So you are worried, exhausted, afraid.
yeah, definitely offering.
How often does this happen? Like the cycle of thoughts?
Probably throughout the day,
So every day?
every day, yeah.
Oh. And how long has this been going on?
From ever since I moved, I guess, into the apartment, I'm so about, I guess, a year.
This is specific, going off for a year. And in that year time frame, has it become any worse, or how did it start out?
Yeah, it start out with just, I would go to bed and I would wake up in the night and think to myself, tonight thought the door and I'm pretty sure I'm locked the door. And then I would just be fine. I couldn't go back to sleep and like I know remember I loved it, but then as it progressed, I would wake up multiple times that night and they would just keep me up.
Isol has your thoughts about it. All right, I want to ask you a few other questions to try to help me figure out what's going on. Shall we?
Yeah, sure.
Have you ever been diagnosed with any condition like mental health condition?
No,
How about a medical condition?
no,
Have you ever used alcohol or any other substance?
no.
Okay. And has this been the first time in your life ever experienced these symptoms like starting a year ago up until now?
Yeah,
Okay. Never anything like this before?
no.
So, for now, our priority is to look for a solution for your current problem. What do you think you should do?
I've no idea.
That's no problem. Take your time and think carefully.
I think I should take time for myself.
Can you elaborate that?
Well, I do think I need to do medication every day to make myself comfortable with my surrounding area and myself relax. And yes, I was having lack of sleep due to these problems all. So I think this will bring me a good solution for me to come out from the solution.
That's good enough. How will you do that?
I think I should start with not wasting time trying to prevent or not think thoughts. And also, I will be willing to accept the risk.
So, any specific dates?
I will immediately start my medication. And also, I will make some happy time for me.
Okay, I believe that you want the best version of yourself. Now, let us summarize the section. together. Earlier, you came to see me because you have been having some symptoms of been bothering you lately. We come to realize that the issue might happen due to lack of sleep and fear of harm from illness. Throughout the section, we came to an agreement that you will make time for yourself to overcome from this problem, and you will make some relaxation training, slow breathing techniques, and mindfulness meditation to make yourself comfortable. Now, shall we discuss your plan of action?
Yes, let's do it. This.